Hello, everyone. We're going to go ahead and get started. Thank you so much for joining us today. My name is Erin Tinnen with the National Center on Domestic Violence, Trauma, and Mental Health. Today's webinar will be Mindfulness Based Stress Reduction for Survivors of Trauma, an Introduction. Our trainers today will be Dr. Dutton from the Department of Psychiatry at Georgetown University Medical Center and Dr. Carol Warshaw, the Director of the National Center on Domestic Violence, Trauma, and Mental Health. Before we get started, I'm going to go over some of the technical details of the WebEx software that we will be using for today's webinar. Many of these details are explained in the Using this WebEx System tab in the upper left-hand side of your screen as well. Please be aware that your screen might look a little different depending on whether or not you're using a Mac or a PC. On the right-hand side of the screen, there are multiple boxes. The second from the top is the chat feature. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in contact with the trainers or myself if you have any questions regarding the training content. You may contact Jennifer Curley, also with the center, if you have any questions troubleshooting the WebEx software. To do this, click the down-facing arrow and select the person you'd like to contact. You'll see a lot of options, but for this session, you will want to select all participants if you would like to respond to a question from the trainer or contact me anytime during the session. You should click on Jennifer Curley to privately contact her if you're in need of troubleshooting the WebEx software. So let's test this chat feature. Will everyone please go to the chat box, click on all participants, type in the program that you're calling in from, and then press enter? Wonderful. Thanks for kicking it off, Megan. And make sure that it's working for a few more people. Perfect. You all can continue to do that. While folks get a lot out of the chat feature, there are times when it moves really quickly and can feel a little bit distracting. If this is true for you, you can feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We will be providing live captioning during this webinar. Below the chat box, there is a media viewer box. This will contain the captions. If you do not want to see the captions, click on the down-facing arrow next to the word media viewer the same way you might if you want to hide the chat box. At the end of the webinar, you'll be taken to a very brief evaluation. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. Sometimes the sound cuts out due to internet connection, so feel free to call in if that continues to be a problem for you. If you're experiencing technical difficulties and are unable to contact Jennifer Curley, you may call WebEx Tech Support to resolve any additional issues. That phone number, which we will also post in the chat box, is 1-866-229-3239. Again, thank you so much for joining us today, and I will now turn the training over to Carol.
Thanks, Erin. And we're delighted to be doing this webinar and so glad that all of you are participating. Let me just move this, let's see, slide. Okay, great. So as many of you know, the National Center on Domestic Violence, Trauma, and Mental Health, which is one of the special issue resource centers supported by the U.S. Department of Health and Human Services Administration, Children, Youth, and Families, Family Violence Prevention and Services Program. And part of our mission is to both improve program and organizational systems capacity to respond to the needs of domestic violence survivors and their children and survivors of many other forms of trauma across the lifespan, and to provide training, support, and consultation to a whole range of providers and policymakers. But part of our mission is also to develop really culturally relevant, trauma-informed approaches to healing from the long-term effects of violence, and to also transform the conditions that produce abuse and violence in the first place. So we really come from a kind of a culture, DV, trauma, social justice perspective. And part of what's so exciting about this webinar with Marianne that we're talking about an approach to healing that incorporates an understanding of the larger conditions that create abuse and violence in the first place. It's the first of an upcoming series that we're just launching on promising and evidence-based approaches to healing for survivors of domestic violence and other types of trauma. Trauma that's often, we often talk about as both individual trauma and collective trauma. And when we're talking about collective trauma, we know that the solutions and ways of transformation are often collective as well. So, and as many of you are aware, there's been a really growing awareness of the benefits of mindfulness-based, approaches for healing from interpersonal trauma. And so part of what we're going to do today is the first half of the webinar, Marion's going to provide an overview of mindfulness practice and talk about the ways that it's useful to us both as providers of services, practitioners, clinicians, advocates, legal advocates in general, and for our organizations, and how it's helpful for survivors of interpersonal trauma, both in a general way and in a more focused way to support healing. So the second half of the webinar is really going to focus on Marion's cutting-edge research on mindfulness-based stress reduction as a trauma-specific intervention, and that will be more research-focused. And we'll pause in between for questions if people are having a lot of questions. One of the other things I wanted to mention was that we're going to do the first part as kind of a Q&A. So we'll have questions instead of lots of detailed slides, and Marion's going to talk about the things that are really important in kind of helping us understand what it means to do mindfulness work and why it's useful for all of us. So before we take another step, we're going to be opening a poll, and we want to ask all of you to participate. And what we want to know is, what is your experience of using mindfulness practices, either as individuals or as in your work with survivors? You know, lots of types of mindfulness practice, including meditation and yoga and labyrinth walking. So we're really interested in having you let us know what you're already doing so we can weave that into our conversation today. And the other thing we would like you to do is, in the chat box, maybe actually write in the kinds of things that you're using that you found particularly helpful, either in your own lives and practice or in your work with survivors. So I'm looking to see what's happening with the poll. In the meantime, I want to introduce, do a little more introduction of Marianne Dutton. So Marianne, as some of you know, she's a professor and vice chair for research in the Department of Psychiatry at Georgetown University Medical Center, and the co-director of the community engagement and research component of the Georgetown Howard University Center for Clinical and Translational Science. She's also the associate director of the Georgetown Center for Trauma in the Community. And so one of the things that's really so exciting about Marianne's work is it really embodies a deep clinical understanding, a deep advocacy perspective, and a tremendous depth of knowledge of research. And bringing them together is unusual and really a gift to the field. You know, she has a tremendous body of work she's produced on the intersection of trauma and domestic violence, and she has a deep commitment to understanding both the effects of trauma and understanding what actually supports healing. So we're really delighted that Marianne will be able to share her insights both as a practitioner, as a teacher, and as a clinician and researcher, and be able to share her insights from her cutting-edge work on the applicability of mindfulness practices for survivors of trauma. So it looks like a lot of you have been already using mindfulness practices in some way or form, and we'll look forward to seeing exactly how you're using them. I also want to mention on our website we have a research brief on the suggested readings, research on mind-body approaches to healing, that Heather Phillips, our research manager, produced in collaboration with Jen Curley, and so we'd love for you to look at that on our website as well. So now I'm going to turn it over to you, Marianne.
All right. So let us just take a moment to come into this moment so we can all do some of what it is that we'll be talking about, which is just arriving at this presentation as a listener, myself as a presenter. And one of the main tools for many of the mindfulness practices is our breath in one way or another. So I would invite you for just a couple of minutes to put down whatever else it is that you might be doing. There's an image on the screen that you should be able to see of the labyrinth if that feels comfortable looking at. or perhaps even gently closing your eyes and just in this moment noticing your own breath for a few breaths in a row. And letting go of all that has come before this time, whatever the morning has brought for you, and also letting go of what will be waiting for you when this webinar is finished. And focusing for now just in this moment, so that we can all open up to this opportunity for learning, this opportunity for our own awareness, and just live in this moment for now. And perhaps allowing yourself to take in a bit of gratitude and compassion for giving yourself this time to renew, to learn, take in something perhaps new, or remind yourself of something you already know. And I thank you for being here.
So Marianne, can you talk a little bit about what mindfulness actually is? The term's used a lot, and it's really helpful to clarify what it is and what it isn't.
I think to answer that question, I'll refer to Jon Kabat-Zinn's definition. It's what I use when I teach mindfulness in an MBSR class. But it really has four pieces, I think, of it as. And that is, the first one is paying attention. Mindfulness is about paying attention. It's really training our attention in many ways, is to think about it. But it's training our attention in the present moment. So our attention in the present moment, not yesterday, not an hour ago, not tomorrow, but in the present moment, and doing that on purpose. So not being pulled to attend something because we're pulled there or drawn there, but on purpose, focusing our attention. So paying attention in the present moment, on purpose. And then finally, a very, very important part, I think, that Jon includes in the definition is without judgment. Many people, when they first begin studying and training with mindfulness, may comment that they're not doing it very well, or they don't know how to do it, or they must be doing it wrong, because they're focusing on, or they're noticing that their attention is somewhere where they think it shouldn't be. And it's just true that once we begin noticing, we notice how our mind actually does work. And so our minds, as the human condition, jumps all over the place. And so when we notice that, to be able to bring our attention back in this moment on purpose to whatever it is that we are intending to focus on, and doing that without judging that our attention has gone elsewhere, is really, I think, what Jon intends to communicate in his definition, and what I also try to teach my students. So MBSR, Mindfulness Based Stress Reduction, that I've referred to a couple of times, which is referred to as MBSR. So that's what I'm talking about. It's Jon Kabat-Zinn's model that now is offered in hundreds of programs across this country and across many countries. Is one approach to teaching mindfulness and to practicing mindfulness. But there are many, many approaches to mindfulness. MBSR embodies a lot of meditation, but many mindfulness practices are perhaps not specifically or even primarily meditation practices. Or they may be focused on something else while maintaining a mindful stance, but it's not meditation per se. For example, yoga or labyrinth walking or Tai Chi or Qigong or some of those practices, although clearly I believe any of those practitioners would probably speak about them as cultivating mindfulness, it's not in the same way as one might understand it when we talk about, for example, sitting meditation. But meditation also comes in many forms, and all meditation is not mindfulness meditation. So that there are mantra meditation, for example, that is very different, where one maintains a focus on something in particular mantra, and not, as in MBSR, for example, opening up to awareness in the present moment, but rather with mantra meditation, the focus is on that particular one mantra. So this is not intended to be an overview of comparing different mindfulness practices or different meditation practices, but just suffice it to say that there are many ways to practice mindfulness, and there are many kinds of meditation. And my own experience and teaching and research and practice comes, my own teaching and research, less so my own individual practice, comes out of mindfulness-based stress reduction.
So, Miriam, so it's interesting when you're talking about the different kinds of meditative practices, and you know, from my perspective, when I'm thinking about things in how the brain is working, that it's probably accessing different circuitry in the brain and different processes, and actually developing different capacities. So, you know, it's also, I think, helpful to think of it from that perspective. You know, how are we building bandwidth, different kinds of bandwidth within our own ourselves. So one of the things I wanted to ask was, what is it that led you to think about mindfulness or consider it that it might be helpful for all of us as practitioners or providers or advocates or people who are working with survivors of interpersonal trauma, both in our work and in our own lives?
Well, I think originally what brought me to that question was both the beginnings in the field of mindfulness and psychotherapy and so forth, but also my own personal experience. I, since the 70s, if you will, dabbled in meditation, mindfulness practices in graduate school and on and off throughout the years. But about 20 years ago, I would say, I became much more intent on developing a mindfulness practice. Initially with Sharon Salzberg, and later with a number of other teachers, but then began to actually experience how I was changing and how those changes affected what I was doing when I would sit with a trauma survivor. And so I think I've thought a lot about this question over the time, and I think there are a number of key reasons why mindfulness can and potentially is very helpful for providers, especially when working with survivors of interpersonal trauma. I happen to think it's incredibly useful for anyone working with people, be it a pediatrician or a physician or even an attorney or a judge, in any human interaction. But since we're focusing here on providers working with interpersonal trauma survivors, I think one of the first reasons why I think that it's helpful is that mindfulness, first of all, mindfulness is something which we can't teach to someone. as if we're handing someone knowledge, or as a teacher in a classroom, or even as a psychotherapy group leader. It's something I believe that best and perhaps only comes from our own experience of knowing mindfulness ourselves. And when we come to know mindfulness ourselves, one of the things I think we discover in our own practice is something about the human condition. And that the extent to which we can be reminded that trauma survivors aren't fundamentally different in their experience from other human beings, in that we all experience incredible amounts of distress. We all experience sometimes gaps in our hopefulness. We all experience distressing emotions. And although there certainly, I don't mean to suggest there aren't differences in those who have experienced trauma, fundamentally we all share the condition of being a human, which I think is more, makes us more similar than different. Of course, many providers, many of us have our own trauma histories, so in that respect, our own mindfulness practice helps us as providers to work with our own trauma histories, even as we're providing some kind of service or intervention to other trauma survivors. I think that mindfulness practices for survivors, the extent to which survivors have their own practice, cultivates greater presence with those we work with. And if there's any one thing that I think probably is the most helpful in working with anyone in distress, is presence. And many graduate school courses teach, being present and being client-centered and all of that. But it's, I think, only through cultivating our own ability to be present that we can offer presence to our clients. And I think then that it's difficult to offer much else if we offer it not from a place of presence, so that when we discover tools that might help, to offer those from a place of presence and recognizing that we share this human condition puts us in the best possible place to be able to offer whatever it is we're offering. Working with trauma survivors has often a toll, as we know, secondary traumatic stress, vicarious traumatization, burnout. And so I think that mindfulness also helps with that. So it, I believe, can be a way of processing, releasing the effects that we have as providers in this field. So I think there are a number of reasons why mindfulness is helpful to providers who are working with trauma survivors.
Thanks, Marianne. So, part of what I'm hearing you say is that when we talk about having a trauma-informed approach, that part of what that means is to be able to be present and connected, and mindfulness is one of the ways that, one of the strategies that can actually help us be able to do that, along with reflective supervision and other kinds of organizational supports. Which is really important to have that, and that's something that is accessible to lots of us. So the next question, the logical next question is, so why might mindfulness practices be helpful in working directly with survivors of interpersonal trauma, as specifically part of our work as opposed to our own work for ourselves?
Mm-hmm. Well, this was a question that I had to think about a lot when I first set about to pursue a grant using MBSR with trauma survivors because it hadn't been written about very much. I don't think there were many studies, if at all, at that point. And a lot of people were quite skeptical that mindfulness or meditation would be helpful, and in fact, a lot of people thought that it was really contraindicated at all if there was a trauma history. And so I thought about it very seriously. I remember many, many years ago at a conference meeting gathering a number of people who were using various approaches that could be considered mindful in practice, some with veterans in VA hospitals and VA programs, and a couple of other people, and just really having a roundtable conversation about this topic. And since then, there's been a number of books and articles, many actually, written about this whole issue of mindfulness and trauma. But I think one of the reasons that for me in the beginning of applying mindfulness work as something that might be helpful to survivors directly was in the context of my work in low-income minority, in my case, urban populations. And that is that the health disparities issues around access to care were also quite relevant in as much as those trauma survivors were not, for the most part, knocking down the doors of mental health providers saying, you know, I need help for my depression or my PTSD, that we have known for quite some time, and certainly it's not new information anymore, that exposure to trauma, and especially chronic trauma, can result in lots of, quote, symptoms, lots of distress, lots of dysfunction, difficulty just managing day to day. But nevertheless, low-income minority trauma survivors were not being provided access to the kinds of services, interventions that were being described in the literature as being gold standard or evidence-based. And not only were they not very accessible, but in my view, the access was not just cost or location or even cultural barriers, but the notion that mental health itself carries with it a considerable stigma. And this issue obviously applies, I think, to generally to our society and our culture, that mental health carries with it a stigma. And so the notion that one could cultivate and train attention or cultivate a mindfulness practice as a way to help that could be offered in a community setting, that could be offered not as a mental health treatment or intervention, but as an educational class, as something that might help, and in fact avoided the mental health stigma pretty much all the way. So that was sort of a big reason. A second one is that there's so much judgment and blame associated with trauma, either for having been in a position to be traumatized in the first place, or certainly for not getting over or having the effects of trauma. And so mindfulness intervention approaches an individual from a position of non-judgment. That is to say, as John says, again, John Kabat-Zinn says in his Full Catastrophe Living, that there's more right with you than wrong with you, or there's more right with us than wrong with us. And so the non-blaming stance of MBSR, mindfulness practices more generally, I think also is very consistent with a trauma-informed approach. It's not only helpful, it's essential. Mindfulness practices, I believe, enhance empowerment in the sense that it's really all about validating one's own experience, whatever one's own experience is. There's not a judgment about, well, you should be feeling this instead of that. what is what is. And it's not to say that in a mindfulness practice one stops there, but by becoming aware of and acknowledging and validating for oneself even, this is how I feel. It opens up options for what needs to be done, as opposed to having someone else, a therapist or a counselor, tell a client, tell a survivor, this is how you should be thinking, or this is a better thinking, or that thinking is wrong, this thinking is healthy. So it validates where one is in the moment, and in my view, allows one to move to a different place once we know where it is that we stand. Mindfulness training doesn't have to be, but it's often offered in groups, and so it provides a sense of community, which is incredibly important for healing. And I think another point that I have been interested in for a very long time, my frustration with many of the, quote, gold standard treatments is that their focus is really on one outcome or the diagnostic outcomes. They're developed for that, and that really is considered a success if one can change those outcomes. And, you know, to some extent one could criticize my own grant for that, because although we were applying to National Institute of Mental Health, you know, we had to focus on pretty much the same outcome as our measure of success. But in fact, mindfulness practices impact the whole self. And I think for that reason, it's not about getting rid of a diagnosis only. It's not about changing symptoms only. It's not even about defining one's experience as symptomatic. It's about essentially one's own well-being as a whole self. So I think that is much more empowering and much more healing than focusing as if symptom reduction is the goal of an intervention. However, if one is to say, well, yeah, that's all fine and good, but there is such a thing as PTSD, there are diagnoses, and of course that's true, and people who have symptoms, who experience symptoms of PTSD or depression often experience them with a great deal of distress. And so MBSR mindfulness, I think also, theoretically, we have not that much actually real data yet to support this or really to study this, but theoretically at least it addresses many of the key symptoms that are characteristic of PTSD. For example, avoidance. It's difficult to be aware of the present moment and avoid one's own internal experience at the same time. So the avoidance is obviously a clear indicator of PTSD, and the extent to which one can cultivate the ability to bring oneself into the awareness of the present moment, that's really countering that avoidance, quote, symptom. A second issue is reducing emotional reactivity. By allowing the present moment to be predominant, the reactivity, which is more often than not based on past events, past experience, the stories we tell ourselves in our heads, focusing on the present moment enables one, I believe, to also reduce the reactivity that we often see as part of PTSD. We know from a lot of research, actually, that MBSR reduces physiological indicators of stress, heart rate variability, to a lesser extent, blood pressure, things of that sort. We have some evidence that mindfulness training decreases sleep disturbance as well. And probably some of the most robust research tells us how mindfulness training reduces the negative self-cognitions that many of us generally in the world, and certainly many trauma survivors carry. And finally, one last point is that mindfulness training does not typically involve processing the trauma narrative. And this is a controversial topic, I think, in trauma treatments, per se. For a long time, people were absolutely certain that in order to heal, in order to improve, one had to talk about and process and get in contact with the trauma narrative. And so one could frame mindful awareness as a way of actually accessing one's own trauma experience, either in the form, mostly in the form of how the experience is carried in the body or the mind today, not so much remembering the events or the narrative of the past. But what it doesn't do is certainly require or even necessarily invite people to tell their trauma stories. And I think for many trauma survivors that I've heard, they don't want to go talk about it again. They don't want to bring it all out again. They don't want to tell somebody again. They don't want to think about what happened to them again. And so the question of whether that is required as part of healing, or is it simply required to be able to access one's own present moment experience and tolerate that, I think is an open question for the field.
So following, I mean, I'm just thinking about all the dimensions and domains that mindfulness practice can touch. And as you said, Marianne, it's like all the domains that make us human and what helps us be present and be able to be really fully present with ourselves and be able to be open to who we are and not without that kind of judgment and without having to shut down or avoid or react as a way to manage that. So, I mean, what a gift that is to be able to actually be with ourselves. So, but what are the other times or circumstances when you wouldn't want to teach mindfulness in working with survivors?
I think there are several, if you will, contraindications that would make it not a choice that might be appropriate in the moment or the present time. And they're probably not surprising to most people, but certainly if someone's actively suicidal, I think inviting someone into their own experience in the context of most mindfulness training programs, which are in groups, would perhaps not be a good idea. Certainly in our own MBSR classes, that's a rule out. What this doesn't address, though, is the use, let's say, of mindfulness in counseling individually, in which case titrating mindfulness training might be exactly what is helpful as part of what else is going on. But I think in a broad sense, an MBSR class, a mindfulness training, I would feel uncomfortable having someone who's actively suicidal in that group. Someone who is active or very recently substance dependent, same thing. Mindfulness training does bring one into awareness of, or does help people access their experience. And for people who have been unable to tolerate their experience, the extent to which they're substance dependent, I think also would be a concern. And people who are unmedicated and are having active psychotic experiences or manic experiences would be similar in that the regulation of just accessing the present moment without those other experiences would make mindfulness training very, very difficult. I think that teaching mindfulness I mean, another circumstance in which teaching mindfulness to survivors is not such a good idea is if the practitioner, the provider, him or herself, doesn't also know about their own mindful experience. That is, doesn't have their own mindful practice, if you will, or doesn't really know from an experiential perspective of what it is they're talking about. So I think that's a contraindication, which is to suggest that not everybody has to go out and become an MBSR teacher for sure. But I think if one doesn't know about something on an experiential level from a mindfulness perspective, they probably shouldn't be teaching that either. And so that's not to say there aren't individual mindfulness skills that one can know and therefore teach. But I think that's kind of a good guide. If you haven't experienced it, you don't know that space, it's very difficult, I think, to teach because we simply can't teach to. We have to really lead people into their experience because we know for ourselves what that's like. Not that we know what their experience will be, but we know what it's like to enter that kind of space because we've gone there ourselves. And often in the training and the teaching, we go there with in that moment as well. So I think just a couple of other points, though, about contraindications. I think that teaching training mindfulness requires a safe place to teach. So even very specific, concrete logistical considerations about safety of the room, whether as you invite people to close their eyes and lie down on the floor and enter a meditative space, that people can be fairly assured that they're in a safe place, that nobody's going to come barging through the door. And so some of my colleagues as teachers actually very explicitly set up the room in such a way that as the teacher, she can monitor the door, will be the first line of entry if somebody happens to walk through the door, and in that way provide a bit of safety for people who might otherwise feel not so safe.
So, Marianne, are there modifications I mean, you talked about some of the things for doing mindfulness, teaching mindfulness practice for when people have experienced a lot of trauma, similar to trauma-sensitive yoga, like closing your eyes or things that you would do differently, or are you going to talk about that when you talk about your study?
I think I'm going to, but if I don't, can we make sure to bring it up?
Okay, great.
Okay.
So, and I think one other thing I wanted to kind of raise that you talked about contraindications, that sometimes if someone is in a lot of distress at the time, if they have the supports that they need in other ways, that mindfulness can be folded into that process. But to do it outside of that might be difficult if people don't have the other kinds of supports they need or things in place or aren't in a state of mind where they can actually access some of the practices. Is that kind of what you're saying?
Yes. I think that for anyone who is struggling in some way, it's useful to have as much support as one can have. In fact, that's one of the screening questions I ask when we offer just a general MBSR course to people who aren't patients, who aren't coming with a diagnosis, but just do you have supports? And so I think if someone's coming with a clear and known trauma history or distress in some way, that having a counselor, having supports, having someone who can provide other sorts of supports, interventions is really helpful. So certainly that brings an opportunity to say that in no way am I suggesting that mindfulness replaces other kinds of help. But it can very, I think, compatibly be folded into almost any other kind of help.
Great, that's what I was wondering. And I was also thinking, you know, if someone is still in danger from an abusive partner, but they're able to actually come to a mindfulness class, is that compatible, or how do you think about that? Or is that are you going to talk about that next also?
Well, actually not so much directly, but I would hope that that person would have all the resources and help and support they would need, even if they weren't considering a mindfulness experience, advocates, safety planning, and all of that. But I wouldn't see that as a contraindication at all. If the individual was able to safely come and wanted to do it, I think it could, in fact, be of some help. In fact, sort of a long chain of thought, but the extent to which one can be more aware and present to one's own experience might actually facilitate being able to make decisions, think more clearly about what needs to be done, whatever it is they decide to do.
That's it. I was wondering about that. So, okay, so now should we pause and see if there are any questions before we go on to think about, for you to talk about your study?
I think that would be good. So
we have not gotten any questions yet. Yeah. No questions yet.
So maybe if people are thinking about those, I can just describe the study, and then we can see if anybody has any particular questions, and if not, we'll go on.
Okay. So
the study.
Go on.
Oh, okay. The study that I was referring to is a study with mindfulness-based stress reduction with trauma survivors, and these participants in the study were low-income, mostly African-American, survivors of at least domestic violence, but in almost all cases, chronic and multiple types of trauma, as you might expect. We were teaching, quote, standard MBSR curriculum, modified in some particular ways, and I'll tell you, but what the standard teaching involved was sitting meditation, lying down meditation, what's called the body scan, which is a pretty highly structured meditation focusing on the whole body. What's also called yoga, which is really better termed, I think, gentle stretching. It can be done regardless of one's physical capabilities, including if one's in a wheelchair, which we have done. So it's not a practice focused on being able to attain a particular pose. It's really about one's mindful engagement with their body, actually moving, or in some cases, only their mental image. Walking meditation is also part of what we teach, eating meditation, mindful listening, and part of the group is also what we refer to as inquiry, sort of self-reflection and facilitating people's reflection. You might ask, reflection about what? It's their reflection of their present moment experience. So, for example, we might do a mindful practice like a sitting meditation or a walking meditation, and then have a period of time of inquiring about what was that like? What did I experience? What was my experience? Not because there is a right experience by any means, but by helping people focus their awareness on what their experience actually was in the moment. The study, as I described it, we looked primarily at PTSD and depression because that, in fact, was a criteria for getting funded. But we also looked at other outcomes, some of which I won't have time to talk about. But we also looked at mindfulness skills and whether those were changing over the course of the training. I think what the implications of our work and that of others as well is that it can bring a different lens to working with trauma survivors. It can help, I think, make a little bit clearer what trauma-informed care in part includes or involves, or what facilitates that. And so in a small way, or perhaps a little bigger way, helping us think a little bit more broadly about interventions or ways that we can help. So here's the study. This is the grant number, if anybody really cares. Some of the background for rationale I'll just present here, the barriers to treatment, just the evidence that was growing about how mindfulness was having a broad range of positive outcomes and overcoming some of the barriers to seeking help. The purpose of our grant was, first of all, to consider the role of mindfulness and self-compassion for trauma survivors, to see whether if we offered MBSR, it would actually change those skills, and whether if those skills were being changed, it actually had an impact on clinical outcomes or not. So here's more of the rationale. I think we can skip that. Just from a study perspective, we were able to retain a pretty good number of people in the study. So this is the percentage point at endpoint after treatment and 3 months follow-up. So here's who the sample is, just for a quick review. Women were in their early 40s. Most had a 12th grade or higher college education, including some amount of college education. We had more than half were unemployed, very low income, as you can see, and predominant African Americans, and the average number of children. In terms of our scores, I won't belabor this so much, but suffice it to say that both the PCL, which is our PTSD measure, and the CESD, which is our depression measure, were at baseline quite significantly elevated, so that we clearly had a clinically significant, if you will, sample that we were working with. And as you can see here, and you'll see it again in the other results, but if you look in the MBSR column, at baseline, 100% of the people met full criteria for PTSD clinically. And at 8 weeks, we had 52%, more than half of them had fallen below the clinical cutoff. And for depression, we also had a pretty elevated depression level. And for the MBSR group, over 3/4 of them, 3/4 of them, at the end of the training fell below the clinical cutoff. So we had a better effect for the MBSR group than the waitlist group. One of our big questions in this study, because it was done now a few years ago, was whether we could actually do this, whether it was even feasible, whether women would actually participate. We did not have what is now pretty common, which is a live introduction orientation session where people could actually come and do one class and then decide if they wanted to participate. And so people were enrolled in the study based on our description. They knew or didn't know what meditation was. Most actually hadn't really had a meditation practice before. But we concluded, based on the attendance and the number of people we retained in actually coming to the sessions, that we did as well or better than our competing studies at the time. And I don't have it on here, but to some extent also compared to some of the other, quote, gold standard psychotherapies in terms of just simply attendance. So we concluded that we did think it was in fact feasible. So here's the graph of our outcome for our major outcome, our PTSD. You can see on the top line, the bottom line is the MBSR group. Both groups start pretty much at a high level, and our MBSR group decreases over time. Our control group also decreases, but we have a significantly different decrease for our MBSR group, which means they did better. And we have a similar pattern, although slightly different shape to it, for depression. We get a significant, and in both cases, a clinically, I'll tell you that actually in a minute, get a clinically significant decrease, not just a statistically significant one. So our question, okay, based on that, we were able to say, okay, we were able to show an effect by reducing PTSD symptoms, depression symptoms, more for the MBSR group than for the control group. One might ask, well, why would a control group get better? And here is where I think we sometimes forget that sitting with someone for an hour, hour and a half doing our study assessments was actually an opportunity for someone to, on a one-on-one, have a conversation with someone about their experience, reporting, answering the questions, but with someone who's trained to be compassionate, listening carefully. And so having that experience perhaps is our, quote, placebo effect. That is, it wasn't that our control group got nothing. They had these contacts, these few assessment sessions. And so it's not uncommon for treatment studies to show an effect for, quote, control groups. But perhaps that's in part why. So the question then was, our next question, so does mindfulness and self-compassion, which is what we're helping people increase in terms of their skills, does it have any impact on trauma skills or trauma outcomes? So we use a mindfulness questionnaire. You may be familiar with this or not. But these are the dimensions of mindfulness that the questionnaire measures: observing, being able to notice, describing, using words actually to describe what one notices, non-judgment, and this is about one's own experience, not events in the world, non-reactivity, and again it's to one's inner experience, not to events in the world, and then being able to act with awareness instead of just being on automatic pilot. So that was one measure of mindfulness, and then we used the self-compassion scale, which each of those descriptors is, in essence, kind of the opposite of each other, so self-kindness versus self-judgment. Common humanity, which really refers to I belong to the human race. We're all experience the human condition pretty much similarly, versus I'm alone, isolated, I'm alone in my distress. I'm the only one, or I'm one of few who is this way, distressed or damaged. And then mindfulness versus over-identification, being able to observe one's thoughts, for example, or one's feelings without being of them. That is, it's not all of me. I'm having this thought, but my thought is not me in this moment. Or it's not all of me. It certainly is me, but not all of me. So our first question was just at baseline, as people come into the study, does the extent of their trauma history impact their level of mindfulness just when they enter the study? And we found that people with greater trauma exposure, if you look at the right-hand most column, that's really what you want to focus on, actually had a better ability, a greater ability to observe and notice their experience. We probably don't have time now to talk about why all of these are the case, but I think we could. Having a greater trauma exposure was associated with actually having less ability to be non-judgmental. That is, people were more judgmental of themselves the more the trauma history. Again, clinically not surprising. And people were less able to report that they acted with awareness. Again, not surprising, I think, clinically. We asked the same question about self-compassion. Greater trauma exposure was associated with greater self-judgment and greater sense of fusion. If one had a thought, a reaction, a symptom, a feeling, it was more all of me. They were more fused, as the term is, than people with lesser trauma experience. Again, clinically, pretty understandable. But our real question here is, if we improve or change mindfulness skills, is that related to changing our clinical outcomes? So here, we found that the MBSR group demonstrated greater change in non-reactivity and also inability to put words to their internal experience, but not the other mindfulness skills. You can see it in a picture here. So the top graph illustrates for the MBSR group the change in their non-reactivity. So they were able to improve quite a bit. The control group, on the other hand, actually decreased, meaning they became more reactive, as they reported it anyway. And the same thing for describing, that the mindfulness group was able to improve on their ability to put into words what was their experience. For some reason, the control group at the final follow-up period had a higher score. This score is not as high as this score, but still, I don't know what accounts for that, that 3-month follow-up. Perhaps there's a training effect based on the repeated interviews, but I doubt that's really it. And then both groups, interestingly, improved on their mindfulness in terms of non-judgment and acting with awareness, meaning there was not a significant difference, but we saw a change for both groups. Again, perhaps asking about mindfulness and their mindfulness experience in our assessments perhaps had some impact, but it's unclear. And do we find that MBSR changes self-compassion? So the element of self-compassion you can see here is isolation. So people in the MBSR group reported less sense of isolation or aloneness. And again, this is not generally alone, it's alone in their distress or their sense of failure. And you see here, this in picture form. So the MBSR group pretty quickly reports less sense of aloneness. The control group gets a little blip and then they go back down. So this is just another way of looking at, does mindfulness skill change what for PTSD is considered a clinically significant change in PTSD? And the answer is acting with awareness, the extent to which you can improve people's awareness. We get a clinically significant change in the number of points, which is 5 on the PCL, number of points required to register a clinically significant change, but it also held for the highly clinically significant change, which is 10 points. And for self-compassion, we find that if we improve self-compassion in terms of feeling the common humanity, I'm part of the human race, this is the human condition, that's associated with greater change in PCL or PTSD scores. And interestingly, a greater sense of I'm not as isolated is associated with lowering depression. Again, clinically makes sense. Let me stop there and not put my questions up, but see if there are any other questions for Carol, if you have comments, questions.
I think there were some questions. Jen, were you tracking the questions that might be good to ask right now?
Yes, so there are a couple of groups of questions that came in. There were a couple that were specifically about asking about, are there additional mindfulness training courses or webinars, either more generally or specific to MBSR, that folks could take? So we could fold that one. There's a question that came up around, like, how do you, the person put sell in quotes, how do you sell survivors on mindfulness meditation, especially when folks are seeming skeptical about how this will help them? Maybe that's a good one to start with.
Sure. When we were beginning to put this grant together, and again, the question of feasibility, would people think, would survivors specifically think that we were out of our minds, or that, you know, are you kidding? I would never do that, especially among African-American low-income women who were survivors. We did some focus groups and went to the shelters and simply talked to people about would they be willing to try mindfulness training. And we were surprised that people, by and large, said they would be. They needed a couple of assurances, they said, one of which was to make a very clear distinction between mindfulness training and religion. And it perhaps is specific to our population. And so I think one of the potential points of reluctance might be that if people thought somehow that they were being sold an Eastern religion, or they were being somehow co-opted into another way of religious thinking, that would be clearly a barrier. MBSR, I think, somewhat uniquely is pretty, I was going to say entirely, but probably as much as any other approach, very secularized. So it really is focused on mindfulness training, which is different from you're going to practice Buddhism, which it really isn't either at all. It comes out of a Eastern religion tradition, but I think how one talks about meditation and how one talks about mindfulness training can be part of what reduces the barriers. And I think exposing people to an introduction, an orientation also is another way that people can just see how it feels. When we do our orientations and people have just a little taste of it, that probably convinces, it certainly convinces many that, yes, this is exactly what I want. And for those for whom are not there, they don't, it's not the right time, it's not what they're looking for, it helps clarify that too.
I also think having stress reduction as part of, you know, this type of mindfulness practice, because everyone experiences stress. It's not stigmatized like, you know, maybe having a PTSD might be, so that might be helpful as well.
It is helpful, but it's a little tricky, Carol. And it's a little tricky because although often people experience a great deal of relaxation, and many of the instructions actually talk about relaxation, especially with the body scan, for example, but it also invites people into their present moment experience. And if that isn't relaxation, they go, wait a minute, why do I want to get more aware of how much pain I'm in? That's not relaxing. And so you have to help people with that, because it's certainly not about, well, let's just get you to feel your pain. That's, you know, that's great. It's not that. It's when you are aware of the pain you already feel, there are more options than if you're not aware that you're even feeling the pain. And that goes, I think, for physical and emotional pain. So it's a bit tricky. Relaxation and stress reduction is certainly part of it. I think it's part of why people sleep better. But there's another part too, which is if people are carrying their own, I mean, they're carrying, and we all do. I mean, it's not just if trauma survivors get in touch with their own experience, but if humans get in touch with their experience, part of that experience can be, at moments, distressing.
Yeah, I'm thinking that, Oh, go ahead.
I was just going to ask another question. Carol, did you want to go ahead?
Yeah, I want to just build on one of the things that you said a number of times, Marianne, that I think is really important about, being aware of our human condition. I think one of the things that's really helpful from learning about mindfulness practices is not just distress, it's how self-critical we all are all the time. It's not a diagnosis, just how our minds work. And so being aware of that and not thinking that I'm self-critical because I should be, because all those things are true about me, but that's just what our minds do, and that is really helpful we talk about normalizing human responses to trauma, but this is really normalizing how our minds work, human responses to life, and it's really helpful to take people outside of being caught. Just even having that perspective, I think, is really useful.
Yes, so. Most definitely that. Right.
Marianne, so another question came up about whether or not standard mindfulness protocols should be modified for survivors of domestic violence and abuse specifically, and if so, why? And also, should mindfulness groups be taught with survivors only, or can the groups be mixed?
Okay, that's a good question. We adapted MBSR a little bit. Not in the content, but in the process. So standard MBSR, and we did this based on our talking with survivors and executive directors and case managers and so forth. Standard MBSR is 8 weeks long. It's 2.5 hours each. And we felt that was too long. And it was logistically too long. Not just too difficult to do, to sit that long or to be in a group that long, but it was people were coming home from work, they had small children, they had to get them bathed, fed, into bed, and they didn't have that much time. And so we extended the number of sessions to 10 and made the classes an hour and a half long. So that was one modification that we did. And we also provided food. We fed the kids while their mothers were in the group. That was critical. We wouldn't have been able to do it otherwise. We fed the mothers as well just before the group started. We also, this is not standard MBSR, it's not even part of MBSR at all, but we put on soft, relaxing, Carol, as you would say, music as people came into the group so that we helped people kind of orient to arriving. So that was one of the things we did. We also de-emphasized the standard homework. And it's called homework, home practice. People are asked in a standard MBSR course to practice 45 minutes a day. We certainly wanted people to practice at home. We provided the CDs, but we didn't want them to feel like they'd failed if they didn't. And we were concerned that if we said we really want you to practice, that would happen. And so we provided this as a resource. We said it may be helpful to you. You know, kind of had it in some ways both ways, but gave people lots of room to be able to do whatever they could do and to support the non-judgment in it. Just one small anecdote that has always touched me, which is a woman who used the tapes, the CDs. You can see when we did this back in the CD days. Used the CDs with her mother, who was blind, who is blind. She would call her mother up, play the tape, and they would listen to it together. So that always was very touching to me. So that, let me think of other adaptations. A standard adaptation in any MBSR group is essentially to take care of yourself first. So if there is an instruction, let's take the yoga part, you know, basically there's the yoga pose, tree pose, you know, mountain pose. People are instructed to do that, but if you cannot raise your foot to put on your inner thigh, and you can only raise your foot to touch your ankle, that's fine. People are instructed to do only about 70% of what you could do physically. It's not about pushing achieving, accomplishing, it's noticing. And so that adaptation, even though the instruction may be to do a certain pose, people are given lots and lots of room to adapt. If you need to sit in a chair, not on lie on a cushion, lots of things. So we made sure to be early and often supporting people in making their own self-care decisions. Those are probably the main adaptations that we used.
Marianne, and then the kind of follow-up question to that was whether or not the groups could be mixed. So should it be survivors only, or is it okay to have mixed groups with survivors and non-survivors?
Our study was just survivors because that was what we were studying. In our MBSR groups that I teach, they're mixed. They're mixed male-female, but they're also mixed survivor, not survivor. So they're mixed people who are, quote, patients in the medical center here, or physicians and nurses, or community people. So they're mixed in all ways. They could be mixed. They could be very specific. I think for programs, I would probably want to run same-sex programs, not mixed gender programs, if they're largely trauma survivors. I think it can work different ways. I see one question that said we're all 50 people in one group, and the answer is no. We had about groups of about 10. We ran multiple groups.
There's a question about...
Yes, go for it, Carol.
About can you do MBSR with children, and if so, how would it be adapted and what ages?
Well, there's an MBSR curriculum for teenagers that Gina Beagle has developed. B-I-E-G-E-L, I think is how you spell her last name. And she has training for working with teens with MBSR. So yes, for teenagers, the MBSR, but there are mindful schools and mindful programs in schools where it's not the MBSR program per se, but it may be simply focusing on the breath, or something like that that is introduced with whole classrooms at a time. And there are programs that train teachers to learn themselves mindfulness skills that they can bring into their classrooms. And there's some amazing reports about how student behavior, just calms down, and how many fewer, quote, incidents or disruptions, or, if people are more able to participate in class when mindfulness training is introduced into the classrooms. The website at University of Massachusetts, if you just Google MBSR University of Massachusetts, you will see a couple of things that might, well, they have lots of resources there, but a couple of things. You will see, you'll see a teacher training opportunities, I think, and you'll also see an online course that they offer online, as well as their courses they offer locally if people are available to travel and be there. But there are many MBSR courses all over, especially in cities where people can access and go to. But there are a few online options as well. Gina Beagle offers an online training for providers of services to teens, I believe, as well.
So I'm thinking maybe we should do the rest of the slides, and then there's room for questions again at the end.
Okay. I think that some sort of next step questions from a research perspective is, how is mindfulness, or how are mindfulness skills and self-compassion really related to outcomes? So I think, what we have is a little bit of preliminary look at that. But I think teasing apart, how much, what about mindfulness training is helpful. So we, I think, have enough evidence, well, we have more growing evidence that mindfulness training helps, but we have much less understanding of how and why it helps and what part helps. So, you know, it's possible once we were to know that we could really focus on specific mindfulness skills that might be the really potent skills for helping, or different skills for different people, depending on what it is they, what skills might, you know, be more or less strong. I think also, but this is more of a research question, I guess, you know, I got interested in how our assessing mindfulness, you know, with a compassionate, non-judgmental research assistant or assessors, in some extent teach mindfulness. And I guess more directly is the question of how to craft very brief interventions that, you know, a primary care provider at bedside could do, an intake coordinator, you know, interviewer on the phone, or a crisis counselor on the phone could do, that providers could use when they begin every session, you know, and a supervisor could use to begin their supervision session with providers, and so forth. How we're not, perhaps, although it's quite useful to think of, you know, 8-week, very long mindfulness skills training programs, that there are very brief interventions that might make a big difference as well. I think those are some questions that I have in terms of next research questions.
So one of the things that we were going to talk about was about examples for how learning mindfulness skills can be helpful in everyday life. And I think you were just starting to touch on some of them, both the, you know, discrete skills, or, you know, techniques or strategies that kind of bring you into the moment. So maybe you could talk about that a little bit more.
I think that one of the things that we heard from women after the group, in terms of how they brought mindfulness to their everyday life. So the example of the woman sharing the mindfulness skill training with her mother was one. We heard lots of examples of women talking about how they used it with their children, both in terms of how they used it for themselves in dealing with their children. One woman, though, again, another very touching example, was how she actually taught her 4-year-old, I think, a young child, to take a breath and then let's talk. So when her child would get really upset, they together would take a breath and then talk about it. And we didn't specifically focus on parenting, although I'm now involved in another project with a homeless shelter program to focus on parenting with young children, mindfulness and parenting. Women talked about using mindfulness skills in their work, so that when they felt a lot of anger and felt, for whatever the reason, instead of being reactive, they would use their mindfulness skills and not. And for some women, they had anger problems in their workplace and would suffer the consequences of being fired and so forth for it. And so I remember one particular woman talked about how she was able to pause, take a breath, and then decide what she needed to say, which in her case was more helpful. The ability to pause and notice with awareness what's happening, what am I experiencing, provides us all with the opportunity to then ask the question, what do I need to do right now? Instead of just react in an automatic way. And so the application to everyday life is endless, if you think of it that way. It could be in a traffic situation, it could be standing in line at the grocery store, it could be, with your child who you're just at the end of your rope with, it could be with a client who's really, really hard and trying your patience or your tolerability. Women reported that in their everyday life, they just felt more whole. One woman, another very poignant narrative, we asked people to write about their experience, what this actually meant for them, what changed. And a woman who was actually in one of the shelter programs that we recruited from, and we were recruiting from long-term programs, not crisis domestic violence programs, but long-term transitional programs, and not just domestic violence programs, but programs where there were lots of women who'd had domestic violence in their history. And this homeless woman said, our homeless program requires us to be out at 7:30 in the morning, and we have to just leave. And she said, but I feel like a whole human being. I feel like a more normal person than I have felt. And being able to sit outside and just notice the leaves on the trees gives me a sense of being more normal than I felt for a very long time. And although, if we looked at outcomes like, is she homeless still? I don't remember what her symptom levels, her particular symptom levels were, but creating a different experience of herself in the world as being more normal, to me, was about as powerful as it could get.
So, and we're going to talk a little bit about what happens after taking an MBSR class, and I know there's still some other questions as well.
Well, I think just a couple of points, and then I'll stop. I think that for some people, it can change the trajectory. It's certainly not a silver bullet. It's not like, well, I did that, I'm done, I'm better, end of story. But it can change the direction of the path. And I think in order for that to be continued to be supportive, like many things, a supportive environment, having a place to go where you can just sit. Our program offers alumni from the MBSR program the retreat day every time we offer a cycle, so they can come back and do that. To support the practice, because I think that's important, whether it be through actual going and sitting with people, which I think is probably more helpful, or whether it's continuing to use guided tapes that that help support the practice, I think are both important.
Great. So, Jen, are there one or two other questions that you think there's time for? I think.
Yeah, I think. Yeah. One of the questions that came up a couple of times were, are there MBSR materials that have already been translated into languages other than English? And if there are, how would folks be able to access them?
I am certain there are. I would start with the University of Massachusetts website. That's really the hub of all things MBSR. And so I would go there, look at the website, inquire as to that. And MBSR is offered all over the world. And so I know it's certainly offered in many other languages. What's available in writing, I don't personally know. I just know that I am quite sure that it's available to some extent.
Great. Thanks, Marianne.
Mm-hmm.
Carol, it looks like we are just about out of time for questions. So if folks have other questions, feel free to email us to follow up. And Erin, when we send out a reminder email. We'll send out some of the answers to some of the questions that came up as well and additional resources.
Oh, great.
Thank you,
so
everyone.
Yeah. And I want to thank you, Marianne, for this has really been wonderful. And I think, Erin, you have some closing remarks?
Yes, I do. Thank you so much. First, I want to thank Marianne and Carol for such an exceptional webinar today. Thank you to Caption Colorado for providing today's captioning, and thank you to Jen Curley for making the webinar run so smoothly. Last but not least, thank you all for spending your time with the center. Within the next week, I will send you all a follow-up email with a link to the recording of today's webinar, in addition to the slides and handouts referenced, and also a lot of the additional resources that were referenced in today's webinar. A lot of that material will also be available on our website. You will also receive a certificate of attendance for your time today. And at the end of the webinar, as soon as you close out of the window, you'll be taken to a very brief evaluation. If you wouldn't mind taking a moment to let us know what was useful and what could have been better, it would be greatly appreciated. Thank you again so much, and we hope you all have a great afternoon.
Thanks, Erin.